you all for joining. We'll go ahead and get started now. I wanted to give a quick introduction. I'm Rachel Pickering with Imprivata. Today, I'm really excited to have you listen in as our speakers, Sean and Rob, share a little bit about how organizations are seeing success with shared mobile devices, some of the challenges that they're facing, and specifically how they're working to overcome those. Before I jump in, quick rundown of what we'll cover today. So I want folks to understand some of the reasons that mobile is being adopted so quickly throughout healthcare, as well as other industries, as well as the things that they need to think about and plan for in terms of making sure that they've got programs that are successful, highly adopted. How to balance some of the intricacies between making sure you've got privacy and a very personalized experience so that it's usable and delivers everything that that end user needs to do their job, understanding what workflows lead into that, and then a quick wrap up with how Imprivata comes and helps to solve some of those. Before I pass it over to the speakers, a couple of quick housekeeping items. This will be recorded, so anybody who you might have that isn't able to attend, or if you want to see the slides afterwards, we'll be sending you to those in the next couple of days. We'll also have Q&A at the end of the session. You'll see a Q&A panel down at the bottom of your screen. Go ahead and enter questions at any time. We'll go ahead and make sure we can get to as many as we can at the end of the session. And with that, I'll pass it over to Sean first, and then Rob to give a quick introduction.
Hey, thanks, Rachel. My name is Sean Kelly. I'm the Chief Medical Officer and Head of Healthcare Strategy for Imprivata. I also happen to be a practicing emergency physician in Boston at Beth Israel Lahey Health. I've been doing that for longer than I care to admit, so have been on the front lines, continue to do so, and so have a very healthy respect for things like workflow and the realities of what happens when technology actually hits the front lines. Does it work? Does it not work? What are the wrinkles there, and how do we implement it in such a way that it's actually usable and sustainable, as well as secure? And so we have, if you're not familiar with us, we have a whole workflow team at Imprivata, which is a little unusual for a lot of vendors, where we have practicing nurses and pharmacists in addition to myself on staff, and we're roaming the fields at all times out there at hospitals, rolling up our sleeves with you, walking the floors and making sure that technology is optimized. So we're really looking forward to the discussion today, and I'll hand it over to Rob for an introduction.
Thanks, Sean. Hey everyone, I'm Rob Zdankiewicz, Principal Product Manager of Imprivata Ground Control. I'm super happy to be with you guys today. My background in my entire career has really been focused around enterprise mobility, and I have been in a number of industry verticals, even from higher education, banking, finance, enterprise retail. And I also spent the last 5 years before Imprivata at the Children's Hospital of Philadelphia, really focusing on a comprehensive enterprise mobility strategy that incorporates a clinical mobility strategy. As you know, those are very different things. I love, and my passion is really about transformative workflows, taking a look at things that you've done previously on in a certain way, and really looking at how can you optimize that with a mobile workflow, making sure people have the right tools at the right time for it to do their job. We're going to be talking about some really interesting stuff today on mobility, and I'm really happy to be presenting. Back to you, Sean.
Great. Thanks, Rob. So let's talk about mobility first and some of the advantages. I mean, look, these are powerful tools, phones, if it will come into focus. Look, we all use these in our personal lives, and I think we like to use them in our work lives too, but of course there are a lot of caveats there, right? When we're delivering patient care, the more of that we can do at the bedside and do efficiently, the better off we are. The more of it that we can do on the fly, of course, and getting real-time access to patient data to help diagnose and then potentially treat patients and interact with patients and family, the better, right? I mean, we're all very familiar with workflows that we used to have to do, like we used to have to go check email or go to our social media accounts, or to do work, we used to have to go and log in to an endpoint and sit there and wait for it to boot up, and then, you know, finally get in and start doing our whatever we want to do digitally and online. If we can just reach into our pockets and instantly access that, if I am in a patient room and there's a question about did my labs come back? And I can quickly pop that device open, get access, immediately look and analyze that, answer that question. I can push that care one step forward, and I can have that interaction live with the patient real time. Obviously, there's a lot of value there. It's not just getting to data, but also for unified communications is a very common use case for mobile devices, and being able to communicate and collaborate with our care team members obviously is huge, not just for reducing costs or reducing burden on some of the stack and how we get to it, but actually on driving higher value and safer patient care, which is actually, of course, what a lot of us caregivers are most interested in, is just let me use the tools that are most efficient for me to bring the care to the bedside and do my job and care for patients as best as I can. That doesn't come without a cost, obviously, right? Look, if we all open up access to things like mobile devices, there's some security risks that come with that, right? Privacy and compliance issues. The numbers bear that out. The more we open up this world and start using these devices, the more that we open ourselves up and we sort of poke holes in those lines of defense, right? And so as this attack surface increases, ransomware and hackers and everyone can get in there. And we're seeing some more security events that are being attributed, at least in part, to mobile devices, particularly ones that are being managed by enterprises for end users. And of course, those mobile devices, how do you track them, right? Do they just walk out the door? Are they vulnerable while they're out there? How do you make sure that they're properly deprovisioned when I am done using them on my particular shift? And so, I just want to be cognizant that it's not this panacea where you should just open things up and let everybody use this willy-nilly. I think we have to be very cognizant that we have the same responsibilities that we always have to maintain data privacy and compliance and HIPAA compliance, and do no harm, not just from a patient care standpoint, but from a data governance standpoint as well. So it sets up the little bit of this tug of war where, look, we want to open up the use of these devices. We want to really use this final frontier of mobility, but at the same time, like, we got to be careful. So I guess we're here to say, look, the old paradigm of saying you have this big tug of war, you have this big choice. You can either open it all up and make it nice and easy to use, or you can lock it down, becomes impossible to use, but it's nice and secure, but it's unusable. So nobody's going to use it if you can't get at it, right? So I think that we need to admit and we need to demand more as healthcare leaders, both on the provider side when I'm practicing and then on the industry side as an executive at a company. We need to break this paradigm and demand more of both. There is good technology based on knowing workflows that we're going to talk about today, that where we can actually get better usability and productivity and efficiency for our end users in mobile, at the bedside, wherever they want to use it, and actually increased security and privacy and compliance at the same time. And to me, that's the secret to all of this, is making the right thing to do and the easy thing to do actually the same workflow.
That's a really good point, Sean. I want to just touch on something really quick we talk about. You're talking about the two sides of the coin. I think first thing we're doing is acknowledging that opportunities and risks associated with any new initiative or workflow change, like a mobile workflow change, it's really just about acknowledging that there are the opportunities for those who are going to be using the solution, and those who are using the solution, acknowledging the risks that are going to be associated with the change. If everyone's together and partnering and making sure these are priorities on both sides, that's where the success comes.
Yeah, and in some ways we're fighting the tide a little bit, because if you think about iPhones in particular and iOS, and to a certain degree Android, but particularly iOS, really are designed to be personal devices, right? Consumer devices. And when we use them as such, they're pretty stringent when we first log in and we first get them provisioned. And once we get that up and running and we enroll in Touch ID or Face ID and we get our password chains all filled, and the convenience starts to tick up, and then it's sort of our device, right? And so they're sort of meant to be used that way. And yet in healthcare, that can be difficult, right? Because you might have a force that are enterprise managed mobile devices, whole teams of nurses and other teams that are mobile and roaming that really benefit from this type of a device. But at the same time, we want to manage them as a healthcare system, and we want to make sure that we offer our IT resources at a scalable means to actually provision and deprovision all those devices, make sure that they're up to date with all the correct security software and up to date on everything else, that the battery's healthy. But how do you do that, right? Like, how you can't expect some poor nurse on some floor and have him or her try to be the mini IT manager for that bank of devices, and then constantly be available to try to log in and get those things set up for every user that comes and goes. And so, like, there are challenges here to these workflows if we're going to optimize and maximize the benefits, both from the security standpoint and from the usability and workflow standpoint that we talked about. And so, to me and to us, workflow is the king of all, right? Like no technology exists in a vacuum on its own. The only reason that we use technology in healthcare, no matter how cool it is because it's a means to an end. It allows me as a doctor to do my job better, or us as nurses to do our job better, or pharmacists or whoever. It lets us do our job. And so without understanding what the workflow is, none of this conversation can exist, and none of this can be optimized. And this is sort of like one of those key cardinal rules. You have to start with the workflow and understand the implications to the end user. So let's just talk through, I think one of the ways that I might be able to be valuable to this conversation is let's just put yourselves in my shoes. If I'm walking in for a shift, like, what are the workflow considerations? And let's shine a really bright light on the pain points of enterprise managed mobile devices. And from there, the discussion around any particular solution becomes much more obvious. And only by understanding the problem can you really reach for a proper solution. It doesn't start with, hey, this is really cool technology. It's like, here are the problems, and here's how we need to surmount them, and here's how we overcome it. So let's say I'm walking up to log in for my shift, and the first time I come in for my shift, I want to pick up a mobile device. Remember, this isn't my own device, so I have to get it fresh. It has to be completely provisioned. And so if I'm expected to walk up and find this device, first of all, if they're located in lots of different areas and not all consolidated in one little charging bank, where do I find them? How do I find them? Who's managing that, right? Is poor Rob, the charge nurse, in charge of all of this when he's supposed to actually be helping to run the floor and everything else that he's supposed to be doing clinically and operationally and administratively? We just don't have the resources to have every single floor managing their own IT like this. So there needs to be some solution where all these phones are there together. They're all charging up. All of the prior person's information has been wiped off of them and deprovisioned, and now they're all reprovisioned. And then when I walk up, that system needs to know who I am, and in a role-based manner, understand that when I tap in, when I give them my identity with a password or a tap in, that device needs to be ready and personalized for me with the apps that I need and none of the apps that I don't, right? And if that is all set and automatically done, and it happens quickly, and then I can just pick it up, I can then log in for the first time, it'll know or learn my credentials. And then from then on, whenever I go into those chosen apps, that workflow needs to be streamlined so that I'm not taking a ton of time and trying to like put a 14-character password or a PIN into every app every single time you need to go in. So imagine if every time you were trying to reach for your iPhone, you not only had to do the device level PIN or app, but then you had to, every time you used any single app, email, social media, whatever. So Epic Rover, Unified Communications, early warning signals, those are the typical workflows. If every single time you had to put a password in, you wouldn't use it. You wouldn't use it. You'd put it in a shelf, you'd pretend you couldn't find it, and you'd walk away and you'd go to the desktop or you'd go somewhere else. And so it's all about those workflows. And eventually, if enough of those things have too much friction, you just give up. You don't do it. And if there are problems during any of that, you can't be expected to be your own IT consult service. Like, that needs to be managed. You need to be able to just plug it in, let the thing deal with it, and pick up a new one that's working. or have something on the back end understand the health of those devices and what's happening and automate a lot of that, because you have to offload that IT burden and the compliance burden and all that from the end users who are just trying to do their jobs and take care of patients. So again, from a clinical and operations standpoint, to me, all I care about is when I walk up, it automatically knows who I am, what I need, and it works quickly and it's frictionless.
Absolutely, Sean. And I think that is a good segue into looking at those same challenges, but from a very different light. You know, you're in IT leadership and you've heard the frustrations, the pain points of clinicians who are just, as Sean put it, just trying to do their job. You've looked at the requirements, and some of them look familiar to traditional desktop computing, but a lot of them are very new. You know, you may not know what a barcode meta administration mobile workflow looks like, but you know you've been given requirements that people need to get access to the devices to power the workflows for these talented clinicians to get work done. Biggest thing here, consistency is going to be a huge component. Your workforces who are supporting these initiatives, however they end up looking, need to make sure that it's consistent so that the end user doesn't have to know about all the complexity. It's just, I get my device to start my shift and it works the same way as it did yesterday. Just like any medical device I pick up, I want to be able to not think about the IT component. It just needs to work. And of course, when going to find that device, to actually access my physical asset, I don't want to hunt through a drawer. I don't want to be unsure if the device is charged. I don't want to be worrying about not having enough devices at my physical unit versus another one. I need to know that when I walk up to this to my unit, that I can access the device. IT leadership, how are you going to do that? How are you going to make sure that there is a device ready all the time? Where's the telemetry that's going to provide that to you to say this unit is good to go? They have enough devices for the expected amount of users, and maybe they have some overage. I need to be able to see that. And of course, we need to make sure that IT is ready and able to support these workflows on mobile devices by really understanding the mobile workflow and giving them the users simple access to those technologies. Meaning, I need to be able to allow them to use that identity. The identity is the core of everything, but without having a significant amount of friction, right? They have badges already. How can we get that identity passed on through the device into the workflow, into the application, so that they can do what they need to do? And I need to do all this in a supportable way that doesn't require me to send my technicians, my support staff on site to possibly one or many hospitals or outpatient services to support, right? We don't want a solution that is going to work part of the time. It has to work all the time, and it has to be supportable remotely from a small subset of IT. And of course, we want to make sure we avoid any of that very deflating scenario where time and money has been invested in a complex solution that just doesn't get used, right? IT is burdened with making sure that all these dollars that get spent on the hardware and the services and the applications that support these workflows, we want to make sure these are in people's hands. How do I see that? How do I make sure that my KPIs show that people are using, adopting, are happy, and are able to continuously access what they need to do, not just now, but in the future as well? So we look at all of those together and we say, well, okay, let's look at it from the lens of that coin that Sean talked about. We look at security and privacy is the number one priority of all those concerns. How do I associate identity? How do I, as an IT leader, make sure that one of the existential threats of my organization is, risks of data loss and data leakage? How do I make sure that fits into the mold while still providing solving for all the problems that we went over for the clinicians? And we want to make sure that they enjoy using the solutions while being secure. How do we drive adoption? Is the security that we are layering on easy to use? Is it accessible? We want to make sure that we do all this, of course, because we want the investments here, not only from the technology standpoint. It's not just from the dollars for buying the assets. We're talking about the dollars in training for clinicians to make sure they know how to get what they need to do. We're talking about the onboarding experience. All of that needs to be seamless, secure, and ideally fun to use, right? We need to make sure this is ready to go so that the clinician can show up, do their job, while simultaneously being secure, giving me telemetry so I can see what's going on and adapt to any changes in the environment, driving adoption, and making sure we make wise financial decisions in the solution for the organization. Moving past that, we need to also make sure that we are supporting new innovative mobile first workflows as well. I'll hand off, Sean. I think this is a great topic for you to talk about in managing digital identity in a new clinical mobile first workflow.
Before you do that, Sean, I actually just want to jump in and run one quick poll to get a feel for the audience today and how they're thinking about mobile. So a lot of times we're hearing, we're early in our journey, but our vision is so much bigger, right? We hear some organizations that are looking to completely rip out those workstation on wheels and go to a total mobile first environment. Some folks are saying, I'd like to be somewhere in between. So I'm just going to hold this up for a couple of minutes to get a feel for where you all are today.
As we wait for those responses, what's really fascinating, and I think Sean, you can speak to, is there's no cookie cutter here. Every organization is so different, but yet so similar. How do you take what are very common challenges and adapt them to your specific needs?
So I think we can see here, there's a pretty big stratification, right? No one's quite there yet, right? Nobody already has made that big shift, and that makes sense because we are still at the cusp of this technology really supporting everything that you need to do, right? But we are right there. So I do think it's interesting that about a third of the folks here today said within the next 2 years, that's what their goal is. That's a lofty goal, and I know it's something that will add a tremendous value to clinicians and patients alike. So let's shift over to you, Sean, to talk a little bit more about how folks are doing that today successfully and how they can be in the future.
Great. So again, I think one of the main issues is just understanding workflows and workflow considerations. And so it all starts with, how do you achieve this issue of actually making the secure thing to do actually more convenient and more usable and more efficient. And really the only way to solve for that is to understand the digital identity of everything that's hitting your system. That's human entities, that's users, it's the devices, even non-human entities, right? IoT, like understanding what are these entities that are accessing the data in the system. And that can be the EHR, but it can be, lots of other things too, right? Biller and payer systems and infrastructure and everything else. And so to us, we look at this that it's about digital identity, and that's the control plane. If you understand who Rob is and what roles Rob should have in the system, and therefore, empirically speaking, because you understand what Rob is logging into and what he's doing on those systems, then what birthright roles he should have, and then what potentially other access should be either granted or not, and provision and deprovision for him. And that's not true just on mobile devices, but with the purposes of the discussion, certainly with mobile devices, you can provision the proper apps, give him the right credentials and access into that immediately, and then not access into other things that he doesn't need access to, and then keep the bad guys out too. And so to us, that's really the major piece here. It's about the digital identity.
That's a great point, Sean, because not only are you making it more secure by making sure I only have access to the minimum I need, but you're also making sure I'm not distracted by things that aren't relevant to me. I don't need that. I want to make sure I get quick and easy access to just what I care about.
Yeah, and this this isn't something that exists in a vacuum, right? Like we have a huge footprint, Imprivata has a huge footprint in the industry around single sign-on and authentication management for lots of other endpoints, right? At desktops and VDI that started even before mobile, and then also with provisioning and deprovisioning with identity governance, so that we are properly credentialing all of our providers and other users into the system. And then I guess arguably more importantly, deprovisioning them when they leave, right? And if they transition from roles, and this became really apparent during COVID as we shifted a bunch of adds and deletes and changes of people, staff moving that, staff that used to be in the ER that were off doing phlebotomy were now suddenly being credentialed to come back and help to work while we staffed up a temporary ICU. And then a few months later, were shifted to another facility. And then after that, they were deprovisioned and they would go back to their day jobs. That's complex, right? And in order to do that properly, having systems that communicate and interoperate with that, and communicating that digital identity with the proper role-based credentials is essential to all of that. Rob, did you want to speak to a little bit to the privacy here?
Yeah, I mean, the challenge here is, the similar tools for everyone, but really making sure that only I can access the data that I need, and that in a secure way. So obviously we want to make sure that I can pass that identity into this workflow. Right? What does that look like? How do I, as a user, from an easy perspective, how do I get into just the data that's relevant to the workflow I'm currently working on? How do we make sure that that is repeatable? When you talk about deprovisioning, Sean, this just means that if I'm a shared device and I'm no longer using it, I want immediately to be 100% confident that no one else is accidentally accessing data that I should have access to. We want to make sure that any of the remnants left over from my sort of session or usage are completely gone, and that the device in this case is ready 100% for the next user. That's what's really important.
So again, I think we've sort of hammered some of these points home around workflow, but again, it's if you're going to manage enterprise managed devices, how do they feel and look and act to the individual users as if they were personal devices? And so, I think maybe it's a good time to address one of the questions that came in through Q&A. I know we'll be talking through those later as well, but the question was, if an organization can just buy everyone a device, isn't that the best plan? It could be, if you want to do that. And a lot of places for physicians will just let them do a BYOD and have their MDM system manage those devices. But as you're probably familiar with, it's not the most efficient model. If you have a bank of devices and you have shift workers, particularly nurses or other transport teams and things like that, then you're getting 24/7 usage, and you're actually, you're able to have fewer devices for 24/7 use. And so you're rotating through, and then you're actually always having those things managed. They're going back into that bank and they're getting reprovisioned. They're getting all the latest security upgrades. There's a whole health check that's done on them to make sure that the battery is healthy. You're tracking those devices so they're not walking out the door. And so we kind of alluded to a couple of the benefits of the solution earlier. We're going to go a little bit more deeply into that. But the long and the short of it is every hospital care delivery organization can do what's best for them. But we are seeing increased interest in managing a bank of devices for all those reasons. They can all be the healthiest, most up-to-date, most secure devices, because while they're sitting there in that bank, they're getting tended to. And then when the user picks them up, it feels to them like it's their device, because we've smoothed over and created this frictionless process where they then can sign in for their whole shift, leveraging password autofill, or if it's an Android device, tapping in and tapping out, and even potentially using touch or face ID if they want to re-enroll their face or their finger for that shift. And so for that shift, it's like it is their own device. But you don't run into some of the issues that some of the nursing unions have, and some of the political and governance issues where workers are like, well, it's like worlds collide, right? Like, I want you to buy me my device, but and I want you to pay for it, but I don't want you to have control over how you manage it and what you do to it, right? And so there's this tension there. Is it your personal device? Like, are you supposed to not be able to use it later? What if you go and download a bunch of stuff that's a security risk, like Rob and his IT counterparts don't like what me and my colleagues often will try to do and have our cake and eat it too, where we all want our own devices. We want the hospital to pay for them. We don't really want them to manage them or have control of the data or the devices, and we want to do what we want on them, which can be risky. So it's fraught with danger either way, I guess, Rob.
Yeah, so it's very interesting discussion, because what everyone's really looking for is a curated experience. And yes, there's an extension of that is a one-to-one shared kind of conversation. But what you really want to make sure is that the user just wants to have a consistent experience. Going back to what we talked about a couple slides ago, is consistent experience. So if you, let's say, give me my own device and I want to go connect to my own, the Starbucks Wi-Fi network when I'm on break, how do I ensure that I get back on the right network so that I get those alarms and alerts from maybe a secondary alarm notification system, or maybe a message from an EHR? How do you make sure that my device is still secure, even though an update is due, and you have to prod the user to say, hey, go get your update? Or do you say, this is a tool that will guarantee a certain experience every time you walk in the door? And how do we do that? How do we take what is a number of requirements? I want to have the right version of the software. I want it to be configured the same way, make sure that someone didn't mess with it since the last time. I want to make sure that you have a great experience ready for your work, for your shift, meaning that you have a full battery. Because even if you give me my own one-to-one device, I can show up with a device that I didn't charge or forgot, or it wasn't charged all the way. Making sure that I have that consistent experience. We need to have a tool that allows IT to empower that. We don't want to have to nag the users to perform software updates. We don't want to we don't want to prod you to say, oh, it's on your responsibility to show up with a fully charged device. All of that can be handled in the shared device fleet. If you want to head on, Rachel, to the next slide here, the one of the biggest things here is, so for simple deployment and management, we need to be able to take all of those requirements for a curated, consistent experience, simplify that, because I can't have IT running around trying to make sure that each device is configured the right way and make sure that each unit has the right number of devices all the time. I can't do that. I need something that I can build a template in a tool and say, rinse and repeat. This will be a repeatable process that scales from one unit to a hospital to multi-hospital system, even, from 1,000 devices to 10,000 devices. I need to have that consistency. And while that's happening, any deviation from that, maybe a poor user experience is detected because battery life and asset tracking has identified that over time the batteries aren't as healthy as they used to be. They're physically getting consumed. We need to be able to see that, so I can plan from a financial standpoint which percentage of my fleet needs replaced when. I also need to be able to see anytime there's a bad user experience. I want to know before the ticket gets created. I want to, these clinicians are very, very busy and they don't have time to necessarily stop in the middle of a workflow and say, this isn't working. I need to be able to see that with my tool that sees the entire fleet holistically. And I want to quantify that and determine how big a problem that is. We also want to make sure that that's, from a security and compliance standpoint, the same is true. Can we, with a very high confidence, know who used what device, where they got it from, how long they've had it, where they returned it to? We want to be able to do that in one console, in one tool, so that we can say, this is our utilization. This is this user's utilization. This is the adoption rate, right? Who's using it? How long are they using it? To what degree are they using a tool? All of that's very important to be able to see from an IT perspective in one spot, to empower those workflows while making sure it's all buttoned down. You want to make sure this experience that we've built, we put a lot of front end effort into configuring and making sure that's exactly what we're delivering. And then it's just a rinse and repeat. We can move on to the next slide. Rachel, too.
I'd add one more thing, Rob. I'd be remiss to just mention this can be used for patient devices too. That was again a huge workflow explosion that we saw during COVID, was managing iPads for patient use. And then, it's not like you're going to buy a bunch of devices for patients. And so this is a way that you could have patients have devices for themselves, particularly during COVID, when it was really difficult because they had visitation, clamped down on visitation policies, and their family couldn't be in the room. And then also to prevent overusage of PPE and communicate with nurses, in addition to all the usual apps and things that patients could use on these devices for entertainment and to stay in touch with the world and to do what they wanted to do to pass the time and increase their quality of life during their stay. And so I just want to, as a reminder, like this is not just for clinicians and staff, but also for patients. And so for both of those reasons, a lot of the use cases pan out. In some cases, makes even more sense for patient managed device, enterprise managed devices for patients as it does for staff.
Yeah, that's a really good point, Sean. One of the things that Imprivata Ground Control excels in is giving you flexibility across for both your plan now and for the future. If you start off as something straightforward as wiping iPads between patients, right? You can pivot that same investment in not only the solution, but even in the hardware and say, well, maybe this is now a welcome tablet, right? And we can provision that remotely as a single IT person with a new workflow and say, hey, these devices are now for clinicians, or these devices are for patients. I can wipe them. I can get them reconfigured, re-enrolled into over-the-air management. All of that can happen with a click of a button from one console using templated workflows, right? So these are things that we do once, as I mentioned before, rinse and repeat. From an asset management perspective is one of the biggest things I hear resonating with customers for Imprivata Ground Control. We want to be able to see this new what makes this mobile workflow so different than traditional workflows, because stuff is not tethered down, right? We need to know that the investments and all the things we talked about are going to actually be usable because the devices are where they're supposed to be. They're in the state that they're supposed to be. And I can plan, such as battery life I mentioned before, battery health. I can plan for future replacements as needed. We also want to make sure that we are using we're a one-to-many approach to IT support. We want to make sure that your ground control allows you to say, hey, I have 1,000 devices out in the field right now. There's a new software update that is critical to the organization. One person push that, right? And not only that, because we know when a device is ready to be taken for a clinician and when it's being returned, we can do all those touches to the device just in time at the perfect time, right? A device coming off of its shift is a really good time to do an OS update and a software update, because we know this device is done, someone's done using this device and it's a good time to get that. Whereas on a one-to-one device, for instance, there's never a convenient time to bug someone to do something. From an end user experience perspective, the consistent experience, what does that really mean? It means that my passwords, using something called Enterprise Password Autofill, are always there on my device to log me into my applications. I want to get access to my EHR, and I don't want to do it. I want to do it using my badge, right? And I don't necessarily, I don't want to have to remember which device is configured to do what. It's just a consistent user experience. And I want to make sure that this is very familiar, right? One of the most popular components of our solutions we have here at Imprivata, tapping into a desktop, we want the same convenience. We want that I tap, get my identities passed on to the device, lets me access my applications. We want to do that, and we want to see that from an IT perspective, so we're confident that someone is ready to go for their work. And then, of course, from a privacy compliance standpoint, over time, I want to know who's accessing what. I want to have a high level of confidence that I know devices are in the right hands, that specific locations have the right numbers of devices, that they need and can are locking those devices down in the right way to preserve privacy while also enabling compliance. We want to do that by allowing the devices to use things like device level pins. So I can say, hey, this device was left at the cafeteria, but it has a pin. The entire device is secure. And we will go ahead and remove that pin when the device is checked back in. It's ready for the next user to set their pin when on the next checkout. We also want to make sure that my identity opens up things that are only relevant to me, right? So based on my identity, I may have access to applications that others don't. And we want to make sure that only the right people are enabled to see the right things. From an audit perspective, over time, not only do you want to know who did what, we also want to know where they did it, right? What device was it on? Where did they access that information? And where did that come from physically? One of the parts of the solutions of Imprivata Ground Control is the unique stance that each dock at physical locations is a kind of a touchdown point. Unlike traditional over-the-air solutions, you get moments in time where you know this device was physically at this spot, and then someone checked it out and physically took it somewhere else. And you can see that starting, ending, whether that's in the same spot or ending in a different spot. All that's really important to have telemetry about what is happening in your environment. Once again, two sides of the coin, so that you can ensure high level of user adoption. They have what they need to get the work done, while also enabling the asset management and the consistent delivery that IT is looking for. Moving on to our next slide, Rachel. So just to touch on this for a second, the scale I mentioned before, huge. You want to have one-to-many support from an IT perspective. Here we have a quote from Chris from Northeast Georgia Health System saying that Imprivata helps us break down adoption barriers to make the most of our mobile technology investments. Checking out a shared device couldn't be simpler. You just tap your badge, pull a phone, log in, and you're good to go. And with the identity-driven approach, staff members can get in touch with the right person quickly and easily, which is extremely important in an emergency situation. So that really says it all. You have what is I mentioned before, enabling of a clinical staff to get quick access to what they need. But we also leverage identity through and through. We can do that at scale. In this case, Northeast Georgia has had fantastic success with over 5,700 daily checkouts. And that's only 2,700 phones. 5,700 checkouts is 5,700, oftentimes, 5,700 users. Here we took 2,700 phones and we enabled them to do a workflow for many folks. But that was accomplished with a single workflow, a single check-in, check-out workflow that allows you to repeatedly deliver this investment in mobile EHR, mobile communications to the right people at the right time. And I want to toss this back to you, Sean, to talk a little bit.
Yeah, so thanks. I want to echo a couple of things that Rob just talked about and sort of, I guess, cut to the chase a little bit. Like, why do places usually invest in this solution? I think number one, enabling those mobile workflows, I think it goes beyond just the granular aspect of it's this one thing they can do. It's freeing them up and starting to use mobile workflows. There are usually at least 2 and sometimes 3 key drivers, like 3 major workflows that most places are trying to invoke at the bedside. First and foremost is Epic Rover, or, and some of the EHRs also, others are doing similar, where they're trying to have more nurses in particular, but also their clinicians charting and performing work at the bedside. There's cost issues around some of the other alternative modes, but there's also just quality of care issues in charting real time. And in order to do that, and if it's an unusable technology, nurses just can't do it. They won't do it. They can't do it. But if they pick up a phone as Rob described, and it enables that to happen really seamlessly, where for that whole shift, when I go up after I tap in and put in that one password, from then on, when I go to the app, it just autofills for me. It makes it really seamless. It is more secure, as Rob said, but also that workflow it's suddenly super efficient and usable. And now I'm in and out of that app really fast at the bedside. So it really unlocks that workflow. There are some incentivizations from Epic, and maybe other EHRs will do the same thing that help economically. But first and foremost, that's a clinical and operations solution that just improves care for the patient. And then, of course, there's satisfaction and burnout implications there as well. And so that's kind of major driver number one is usually Epic Rover or Cerner Mobile or other EHR at the bedside. Major driver two is usually unified communications. Most providers will carry some sort of a communication device. Oftentimes it's one they don't like. That's a more rudimentary phone. And they're sick of having a bandolier of a pager and 3 phones and their own personal phone. And like, what's ringing? What do I do? It's just asinine, right? So they want to consolidate to one device, just like we do in the real world where hey, it's more efficient. I have my iPhone or I have my Android and it just works. And I can use it for my unified communications on a role-based manner, as well as to do my EHR bedside. The last thing is early warning scores or signals that are coming in, like for sepsis or nurse call, things like that, which can be routed through unified communications and sometimes is separate. But I would say those 2 or 3 workflows alone are the major drivers on the provider / clinician and staff side. The patient ones we talked about earlier. And then from an IT or a management standpoint, the security and then the device management, asset management alone usually justifies the budget almost within a year. Because if you have an enterprise mobile initiative going on and you're losing 10 or 20% of devices per year because they're walking away or they're being stuffed in the drawer and then they go out of battery and you can't find them, and you're having to replace those. That combined with battery replacement and unhealthy batteries, and then security risks of having devices, as Rob said, that you can't monitor proactively, that alone usually justifies budget for something like this. And so those are the major drivers. But like we were talking about before, this is skating to where the puck is going. I think it's once you enable 1 or 2 of those initiatives, becomes apparent that more and more workflows can be built in, and you can start leveraging the power of a mobile platform. Lots of places have put in MD Calc or other like apps that are helpful for when you're doing your job as a nurse or as a doctor. And so if you're doing peds dosing, you need to look something up, or if you need to look up the hospital policy, and it requires walking over there and logging into a computer and waiting around versus like bang them in. They're going to do that, and they're going to get the right answer, and they're not going to make that mistake, and they're not going to not comply with something you want them to comply with. So I think we're only seeing the tip of the iceberg as far as the value. But I think already, even with those 2 or 3 simple use cases that Rob talked about, and then again, to circle back to that earlier question, why not buy everyone a phone? Well, you get 2 or 3 amounts of the bang for buck out of all of these devices, plus you manage them more efficiently, plus you guarantee the security on them, plus there's not the governance and the political issues of, it's my phone, what are you doing on it? Like, I want to have Facebook on it, right? And, oh, you should pay for my phone. I don't want to pay. A hospital system doesn't necessarily want to pay for all of its providers and nurses' personal phones. So anyhow, I think there's a lot of reasons why this has been successful. We're seeing amazing growth in this area. And anyhow, we're love to open up the discussion. I see some questions in Q&A and do a deep dive on some of the issues that came up.
Thanks, Sean and Rob. I'm going to do one more quick poll before we jump into that Q&A. Again, similar, getting a little feel for how folks are looking at mobile within the next 2 years. Whether you're, looking to expand, whether you're still on the fence. And, I think that drives a lot of, the conversations that we have with folks moving forward.
I think interesting component of looking ahead in a strategy or a comprehensive mobile strategy is looking is first you look back and say how we are somewhere that we didn't necessarily know we were going to be 5 years ago, and that might be true in the next 5 years. How do we make investments that allow us to pivot while retaining, making the best of our investments? And I think that's what's going to be the key going forward.
Thanks. And so obviously here we can see it looks like the overwhelming majority are looking to do more with mobile over the next couple of years to either optimize or maybe start their mobile journey. So all things that folks want to think about. We did get a handful of questions in here, and I'm going to summarize a couple of them together that fit into one bucket, and then we'll start to knock them out in the next 10 minutes as we have time. Rob, first one is a set of questions for you around how we work with MDMs. And so I think it might be helpful for you to give like a quick high-level flyover of how ground control communicates with an MDM. And then there are some specifics around which MDMs we work with, some questions around how we work with Workspace ONE Launcher in general. But I think maybe if you can kind of sum it all up together, that would be helpful for all of the folks.
Yeah, absolutely, Rachel. So we've talked a lot about the workflows, but let's get into the nitty gritty of what that actually means. Ground control is best friends with MDMs. And what I mean by that, not only do we have support for many of all of the large MDMs out there, VMware Workspace ONE, formerly AirWatch, Ivanti Endpoint Manager, formerly Mobile Iron, Jamf. We have support for Mass 360, and of course, one of our biggest integrators recently is Microsoft Intune. We work with these MDMs who are very, very good at communicating with the devices over the air, over Wi-Fi, over a wireless connection, but bring locationality and identity to that experience. What I mean by that is the MDMs can maybe associate an identity to a device, but doing so with a badge tap at a physical location allows me as an IT admin to say, this device was secure but not in use. And when it was checked out and ready for use, we associate an identity with that device. And whether that means we just bring your passwords into the device using integration with OneSign, or if that also means delivering that identity back to the MDM so the MDM can then render an experience over the air. Example, one of the questions I see is about how fast does it take, can we get applications on the device after a badge tap? What we see and most commonly used is all the applications that could be used by different personas are already on the device. We simply unhide them, right? So when I tap and I'm a nurse apps are immediately available, or maybe the Rob apps, maybe because Rob's a manager and he gets access to something a little bit different. All of that we can handle by not only talking to the MDM, or we utilize APIs to talk to all your MDMs to make sure that the devices get what they need to get, but it allows you as an MDM admin to add a whole new dynamic to this and say, I always used to be able to see if a device was in use because it was connected to a Wi-Fi, right? Or it's powered on and it's talking. But now I know where is it physically, and when it stops talking, even if that device is just misconfigured, I can see it physically connected to a dock, and I can also put that device in like an overdue lost mode workflow, which is very popular, where we lock down the device and say, hey, this device, has been checked out for longer than 24 hours or longer than 72 hours. It's really got to get returned to the dock. And all that, meanwhile, the last identity, the last person to check that device out, of course, is on record. And we can even automate a message to them or their manager to say, hey, Rachel checked out a device a day ago, she hasn't brought it back. Or even Rachel checked out a device and put it back in an unexpected location. We just want to let you know that. All really powerful things that we add on top of what an MDM can already do over the air.
So I want to double down on that, because what Rob just said to Andrew's question, to me as the nurse, when I walk up and tap in a few seconds, that device, the one that's the most healthy, batteries most charged, fully provisioned, comes up with the apps that I need on it in a few seconds. I just want to double down. Like that's why this is auto magical to me, the nurse. And then I walk around, I use it all day. If I forget to bring it back, it can go into device lost mode and automates an email to me first. And then it can go to my supervisor if it's still there. And then you can shut that thing down and brick it. Like, I mean, that's like Rob's too modest. Underlying all of this, there's a lot going on, but to the end user, it just works. Like I just tap in, it knows my role, it knows my apps, it just works. I use it for the day, I turn it in, I don't worry about it. Like I'm done. Like at the end of the shift, I plug the thing in, I'm gone. And if I forget, it notifies me so that I can bring it back. You don't lose that device. Sorry, Rob. I just emphasizing that to the end user, this is priceless. And you said something earlier. It's so aggravating when, as doctors and nurses, you expect me to create a ticket when stuff's not working. Like, how do you not know things are not working? So this does the opposite. Like you plug that thing in, you get an alert, you get a dashboard. If the battery's not healthy, take it offline, figure it out. Like, don't give me a phone that's not working so that I have to call you about it. Because guess what? I'm not opening up a ticket. Like when I have a line of patients out the door who have already been in the waiting room for 12 hours, despite like bleeding profusely, they're not going to wait while I get on the horn and create a ticket for you. So this has to be done behind the scenes. And this is the kind of stuff, this is the homework it takes to get that auto magically working for the end user. So thanks. I just wanted to emphasize to the end user, this is all the difference in the world.
Yeah, super good call out, Sean. And we even have workflows that allow you, to your point, for as the clinician to notify IT, something's wrong with this device. I don't know what it is. I'm just going to tap a button, drop it in the dock. IT can see that immediately and say, someone said something's wrong with this device. I'm going to dispatch a technician. I'm going to create a ticket automatically with integration. We can do all of that with ground control. And as far as going back to support, so I mentioned a bunch of MDMs. I also want to just make sure everyone knows ground control and this year has introduced support for not only iOS traditionally, we also have support for Android. And that includes a number of different Android manufacturers, including Zebra, as well as Spectralink, Honeywell, and Samsung. All of the most popular devices in healthcare are things that are device types that we are able to support now with our check-in and check-out workflows.
And mixed environments. A lot of you have mixed environments.
Absolutely. We often find
both Android and iOS.
Yeah, we often find organizations that say, oh, we're an iOS shop or an Android shop. There's typically always some group that has a different workflow with a different application need and may need a different platform. Now in a single spot, once again, I can associate those identities, see all that from an IT management perspective, and see utilization too. How much are you say you're using these devices? Well, let's see it. Okay, 1,000 checkouts a day. Okay, you're definitely using it. That's really a powerful tool.
I want to jump in and have Sean expand on something a little bit more because I think it would be helpful for the audience in terms of getting to a point of success. When's the best time for those IT and mobile teams to start to involve the clinical end users when they're planning and evaluating a mobile program?
Yesterday. For real, for as early as possible, whoever feels the pain of these workflows, not just from managing them from an IT perspective, from the usage and the clinical and the operations standpoint, get them involved early to have a collaborative discussion on what the ideal workflow is. We can share best practices and lessons learned across hundreds, thousands of deployments so that you're not just reinventing the wheel. But getting the clinical and operationals folks involved, we will do a quick workflow review with you, including the footprint of where devices are, where people like to pick them up and drop them off, and exactly what apps to use, what they might use them for, what the resistance would be. Trust me, the earlier the better to get these folks involved and then have a collaborative approach. It's just 1,000 times better. Thanks for that prompt.
No problem. Thank you. And it looks like we're right at time. So I want to thank you, Rob, and thank you, Sean, for joining and sharing your expertise and background and information with folks. To everybody who did join today, appreciate you giving us the time. There'll be a recording shared as well as a quick link in the follow-up to an upcoming webinar that we have with Sean and Chris from Northeast Georgia, which Rob mentioned earlier, where they'll be digging down a little bit deeper into how Northeast Georgia has really improved workflows in their environment. I think that'll be helpful for a lot of folks here. So keep your eye out for that email. Thank you all again so much. Hope you have a wonderful rest of your day.